Hello, my name is Angela Bryan, and I am a senior at Iowa State University, majoring in Animal Science Pre-Veterinary Medicine. Throughout this presentation, I will be covering a condition in equine known as laminitis, specifically pasture-associated laminitis. As you can see there to the bottom, I will first discuss what initiates this pasture-associated laminitis, followed by the mechanism that is occurring internally, followed by the external presentation of symptoms, the internal effects, and lastly, the preventative measures owners can take. So what is laminitis? Laminitis is a debilitating condition seen commonly within ponies and adult horses. This condition manifests in the foot as severe pain due to the inflammation of the laminae. This condition is associated with the separation of the hoof wall from the rest of the hoof. As the pedal bone descends and points near the sole, the flexor tendon is pulled, which leads to the pain the horse feels. What are the laminae? Laminae are located within the wall of the hoof. As you can see in the photo there to the right and below, A illustrates the laminae that are attached to the inside of the hoof wall, while B illustrates the sensitive laminae. These structures are responsible for dissipating the concussive forces, specifically the forces incurred when horses are in motion. Association of the pasture to laminitis. So first, I would like to cover a bit of the pasture association and how the laminitis occurs. To begin, pasture is made up of multiple non-structural carbohydrates. Those carbohydrates include simple sugars, starch, and fructans. Pasture grasses contain a variety of structural and non-structural carbohydrates, as I previously said, but with respect to increasing the risk for laminitis, fructans found within some pasture grasses are the most important here. Fructans are non-structural carbohydrates, molecules with which enzymes within the small intestine are unable to break down. Because of this, the fructans bypass digestion and absorption. Because the fructan structures are not broken down, they are presented to the large intestine fully intact. Microbial matter of the large intestine then ferments the intact particles and produces the increased acidic environment that contributes to further problems. So what are the periods of risk? Well, the higher the fructan content within the grass of a pasture, the higher the risk to the horse. Despite the fact that fructans clearly pose a problem to the health of pasture-fed horses, there are managerial procedures that can be implemented to limit the occurrence of laminitic problems. Most generally, fructan content is greatest during active periods of plant growth, periods that largely encompass the months of spring and early summer. During hours of daylight, the plant is actively undergoing photosynthesis. On the other hand, the plant is using its previously photosynthesized carbohydrates for growth during the dark hours of night. Overall, concentrations of these carbohydrates rise during the morning, reach a maximum in the late afternoon, and decline overnight. In addition, stressors may increase the content of fructan within a plant as well. Cold stress increases fructan content, especially on cold autumn mornings. Overcast also affects these results. As you can see in the graph to the right, water-soluble carbohydrates are greatest within fresh grass as well as dried grass. And this is largely associated to the problem associated with laminitis and pastures. So what is the internal mechanism occurring here? Science actually clearly suggests now that the development of pasture-associated laminitis is based on an initial drop in the pH of the large intestine of the horse. So to begin, let's go through the steps. The sugars and starches within the intestine ferment. This produces lactic acid and an increasingly acidic environment. The newly acidic environment of the intestine causes acid-sensitive microbes to deteriorate and acid-resistant microbes to flourish. Although still in question, it has been assumed that after being absorbed by the large intestine, these bacteria then travel through blood vessels to reach the hoof wall. The bacteria may then produce substances that can activate specific enzymes within the wall of the foot, breaking down the bond between the pedal bone and the hoof wall. At the hoof, the wall then separates from the pedal bone. This separation causes a displacement of the pedal bone and pulls on the deep flexor tendon, leading to the pain and overall debilitation of the horse. So presentation of this condition, both externally and internally. Horses with this condition will often present themselves by standing with more weight on their hind legs, and this is an attempt to take weight off of their front feet, which may be in pain. Also externally, the hoofs may seem warm to the touch, and the horse may be highly resistant to walking or turning around. Internally, blood vessels may be constricting. Laminae have been damaged and are pulling away from the hoof wall. Pedal bone descends, as you can see there in the figure to the bottom, either mild, moderate, or severe, and blood vessels have collapsed. As the sole becomes compressed, further crushing occurs, and ultimately the foot will become infected. Within this illustration here, you can also see further presentation of this condition. To the bottom there, you can see the hoof wall will show rings, illustrating a possible laminitic condition. So lastly, let's cover some of the preventative measures for owners to take. Clearly, recognizing and treating a laminitic condition in its early stages is vital to preventing the pain associated with this condition. Ideally, avoiding this condition from initially developing would be preferred, and because of which, an implementation of countermeasures and interventions is pertinent to the comfort of these horses. Preventing pasture-associated laminitis initially involves assessing the risk posed to each individual horse. So determine which horses are really prone to developing laminitis. These will include the overweight horses or horses with a history of being overweight. As for other horses, there are methods of limiting and monitoring the consumption of fructans and other non-structural carbohydrates. To begin, pasture time should be limited daily, either from minutes to several hours. Also, avoid grazing during periods of high risk. As addressed previously, they would typically involve grazing late in the night and early in the morning, when fructan content within the grass is at a low. Also, owners may wish to implement the use of a grazing muzzle to limit the horse's exposure to the grass. And lastly, owners may wish to rotate the use of their paddocks regularly to make sure their grasses are managed properly. Overall, horse owners and barn managers must be cautiously cognizant of the factors affecting the development of laminitis within these animals. Management practices may include full restriction of grazing during hours of high light intensity and low temperature. This responsibility of the horse owner or barn manager is vital to the health of these horses, especially in preventing laminitic episodes. With that, I would like to provide you with the literature I have cited throughout this presentation. I hope you enjoyed. Thank you for your time.